Hi, I am Daryl Munden, president of RX Outreach, and RX Outreach is a sponsor of this series of webinars, the first that you'll enjoy today. I want to talk a little bit about, just to give you a little bit about NAMI, who is partnering with us in this effort. NAMI St. Louis is the St. Louis affiliate of the National Alliance of Mental Illness. They are a local nonprofit that provides mental health, education, advocacy, and support at no cost to participants in the St. Louis area. We are excited that you are here to join us for this first of a series of live webcasts sponsored by NAMI of St. Louis and RX Outreach. RX Outreach is the nation's largest nonprofit mail-order pharmacy. There's no one like us. We provide affordable medications to people in need all across the United States. We serve those up to 400% of the federal poverty level. So a single person making $47,000 or a family of four making $87,000 can qualify for over 1,000 different drug strengths of medication. Our mission is to provide affordable medications to people in need, and it's just that simple. We are here today to talk about medications and the risk of not taking your medications as prescribed by your doctors. Before I introduce our guests, I want to encourage you to send us your questions. This is a live webinar, and we will be looking and soliciting your input and feedback to us as we go through this webinar and share this information with you. You can post them through the webinar or on Facebook. If we don't get to your questions, we will email you with an answer. So let me just take a couple of minutes and introduce our esteemed guest here with us today. To my right here, Dr. Mitchell Botany has been in private practice at Missouri Baptist since 1999. He is board certified in internal pulmonary medicine. He earned his medical degree from Ohio State University College of Medicine. Don't hold that against him. He completed his internship and residency at Jewish Hospital at Washington University School of Medicine. He has held clinical and research fellowships in respiratory and critical care at WashU. Dr. Botany has also taught at WashU as an assistant professor of medicine, was involved in pulmonary research, and is the author of 35 journal articles. Thank you for being with us.
Thank you.
Tiffany Redmond serves as a pharmacist, a staff pharmacist at RX Outreach. She holds a doctor of pharmacy from St. Louis College of Pharmacy, located right here in the St. Louis area. She has over 11 years of experience in mail-order pharmacy operations. She started a career with Express Scripts before joining RX Outreach in 2010. Tiffany, thank you for being here as well. So let me also introduce to you Joyce Johnston. She has worked at NAMI St. Louis since 1994. She started as a volunteer and is now the director of programs. She has an MBA from Lindenwood University. Joyce has had a bipolar condition disorder most of her life, and she stays well by taking her medications and using psychotherapy as needed when life becomes overwhelming for her. Joyce has 3 adult children, 2 of which have bipolar disorder. So this is our panel, and what we'll do is we're going to go through a series of questions, and I'm going to look to you all to share with our audience some insights, valuable insights that they will need as it relates to medication and medication adherence. So why don't we start out here? Why don't people take their medication? It seems like a reasonable thing to do, but what gets in the way of people being able to take the medication as they need to?
Well, there are a lot of reasons. The first one that I think of is that no one wants to be on medication for the rest of their life, which is what I have to be. And also there are lots of side effects. I, in particular, had grinding my teeth, which caused me to have TMJ, and it just complicated it for me. Also, there can be sexual problems. There is also weight gain, and it makes it really hard if you have a dry mouth and you're having tremors to function on an everyday level around other people. So you're very cognizant that you do have some of those side effects, and they're quite obvious to other people.
Okay.
Yeah, and sometimes there's even a negative attitude towards mental medications from the media or even your family members or friends even. So they're shy to even admit to take them and to even take them in the first place. So that's always something that patients may run into. Another reason is financial. They can't afford their medications. So
that's a big problem today, isn't it?
Yes, definitely.
Yeah.
Yeah, and so they cut their tablets in half to help, prolong them sometimes.
That's right. Sometimes they don't think the medicine's going to work, that their problem isn't going to be fixed by medications. And sometimes it's just we forget to take our medications, and that happens to everybody. I mean, I don't know anybody who is that compulsive who will remember to take their medications once, twice, or even especially 3 times a day to take their medications. It can be very, very difficult to do.
So, what should someone do? I mean, to try and be as most adherent as possible. Should I try and set up a routine, to try and, because medication is so critical and it's so important. Are there any recommendations you might have to maybe help us or help them be adherent with their medication?
Well, I would say that taking them on a routine is going to be very, very helpful. Get into that habit of taking your medication. Not only does it help you take the medication, but these medicines are oftentimes scheduled for very valid reasons. The lifetime of the medicine, for example, in the body. And if you don't take your medicines on that kind of a schedule, then you're either going to have erratic dosing and you're not going to get the kind of blood levels of the medicine that you're going to need, or you can actually get too high a blood level, and then you're going to get more likelihood of adverse events taking place. So being on that routine kind of a schedule helps you to remember and also helps you take the medicines in the right way.
Yeah.
And Daryl, for me personally, my family helps me with taking my medications. I set out my night I set out my day medications because in the morning it's kind of hectic, and if I forget them, they're sitting there, and so my significant other will call me, and I carry an extra dose, 2 extra doses of medication just in case I do forget my medicine because I know it is very important to my health.
Okay.
Yeah, and keep it somewhere where you will remember, like your nightstand. As soon as you go to bed, if it's a nighttime medication, even pill boxes and unit dosing can help people. At least they can remember if they actually took their, morning dose and things like that. So help them to remember that.
So let me ask you this: what happens if I, forget to take it? I'm supposed to take it in the morning, but I forget to do so. Is it okay to just say, okay, 6 hours later or at the end of the day, I'm going to take that medication? Or should I just wait till the next day, potentially, to take the medication?
Well, obviously, that's very dependent upon the actual medication that we're talking about, extended release versus immediate releases. In general, if you think you forgot or you're not sure, definitely don't double up on that dose. And usually if it's later in the evening or whatever, and if you're not having side effects like you had said, then I would go ahead and wait till the next day. But like I said, it's a very wide variety of medications out there and formulations, so it's very dependent upon the actual medication.
From a doctor's perspective, what is it that you can do to help people understand the need and the importance of taking that medication that you prescribed?
I think communication is at the heart of medicine, and probably no more important is the role of communication in taking your medicines. From my personal perspective, I feel it's my role to explain to you why you're going to need your medicines. I'm going to need to explain to you why we're scheduling them in this way. To get back to that point, there's a lot of science behind the scheduling and the dosing of medicines. And it's important that you understand why I'm asking you to take it just once a day or twice a day or 3 times a day, because there's going to be differences in the way the medicine is absorbed and the longevity of the medicine in the body. I want to tell you what kind of common side effects that you can expect. These are things that happen to 10% of the people in the country who are taking that kind of medicine. So it's not going to be unusual that you might experience it. And I want you to know what I would ask you to do if you have some of these side effects. Some of them are going to be slow in onset, and it's going to be maybe 6 months from now before you notice them. Some of them are going to be very rapid, and the way you respond to those side effects is going to differ depending upon when they show up and the acuity or the severity of the symptom that shows up. These are all the kinds of things that I think a patient has a right to know to when they're starting the medicine, and I think is an obligation of the physician to tell you. And it's working together like that hopefully will give you the best result. Or if you get a side effect, will allow me to change your medicine, change the dose, change the schedule if that's something that could be done, so that we can avoid having the side effects that pop up.
So from a pharmacist perspective, Tiffany, do you happen to have this type of conversation with patients quite often?
About taking their medications? Yeah, actually, they do. Actually, what is a common question is about cutting tablets and can I crush them? Can I, open them up? That's a very common question for patients that call about all, disease states and everything. And if I only take it once a day, what is it going to do to me? I'm supposed to take it twice a day,
Is it okay to crush pills?
That's very dependent upon the medication. Some are and some aren't. Extended release, sustained release tablets are usually not okay. There are some that are, but in general, they are not. But capsules can sometimes be opened and put in like applesauce for children or people that can't swallow well, things like that. So there are things you can do. You just have to ask your pharmacist or doctor about that.
Okay.
Yeah, I would add one other thing is some medicines have a coating to protect them from the acid in the stomach, because that acid can degrade the medicine, and if you crush it, you're getting rid of that protective capsule. Then you may think you're taking medicine, but it's going to, by the time it gets into where it's absorbed in the intestine, it's already lost a lot of its potency because of the acid effect on the medicine. So those are certainly medicines you do not want to crush.
This is something I think that I know personally that I question, and it's so where is the right place to store medication? Is it okay to leave it in the car and it's 100 degrees outside, or where should I keep my medication?
Definitely in a cool, dry place, away from sunlight, not in the car, definitely, because it would be exposed to heat, sunlight, maybe extreme cold, basically no extreme temperatures. In an amber bottle, preferably, helps it not being degraded. Up high, out of kids' reach, for like child resistant containers. Although they're not always child proof, they are child resistant. So again, that is important too, because children can get into those containers even though they're not supposed to be able to, but definitely can if they play with it enough and observe it enough. They can learn how to open those. So up high, be careful when you have your purse out and there's children around. They like to get into purses and things, and even your pets. So up high, cool, dry place is generally where you want to keep it.
Yeah, I'd reinforce what Tiffany is saying, is that these medicines are just chemicals, and chemicals are negatively affected by temperature. They start to degrade at a faster rate than they ordinarily would at the higher temperatures, and when you add humidity, then that goes even faster. So proper storage, again, is essential, because you may think you're taking the medicine with full potency, but the degradation that's taken place over time by storing them in your glove compartment, where not only is the temperature high in that car, but the humidity, the windows are all steamed up, then you're going to really degrade the quality of the medicine, and then you're not taking the medicines, getting the full benefit of those medicines.
Yeah, and you might, experience side effects, and you may not know why, because you're taking it as, you're told to. Right. So it may just be because the medication has been degraded a little bit from how you were storing it or.
Right.
So, today there are a lot of different other medications, over-the-counter type medications and things like that that you can buy. Should I be worried about taking a medication, over-the-counter medication, with a prescribed medication from a physician? Should I ask them about that, or should I ask you about that, or should I tell you about that?
Absolutely. Your doctor doesn't always know what you're getting from other doctors. Even pharmacies, they don't always go, to the same pharmacy all the time, so they do not have record unless you tell them what you are taking. So always ask and give a full report of your medications to either your pharmacy or doctor so they can review all the medications to see. Don't start taking any over-the-counter meds unless you've talked to your doctor or pharmacist first. There are many ways it can affect the medications. It can increase the toxicity of meds. It can also, keep from being absorbed in the first place. So there's lots of things that, St. John's wort is one that's people like to take for depression and things like that, a natural supplement. It can definitely interact with things, medications, and lead to side effects, serotonins, and whatever. So.
Let me just give a couple of common examples to illustrate. So a lot of people take antacids. Antacids can prevent the absorption of a medicine, depending upon what kind of medicine you're taking. So that's one where you're taking something over the counter that would really have an impact on your health because of its absorption is impeded. Another one is aspirin. If you're on a blood thinner, well, you can get aspirin over the counter, but if you're on a prescribed blood thinner, your doctor may not want you to be on aspirin as well because that actually is also a blood thinner. And so you're getting more of a blood thinning effect, and that just increases the likelihood that you're going to have significant bleeding under some circumstances. So those are two common examples where you would want to make sure that you're not having that kind of interaction with an over-the-counter and a prescribed medicine. So I would go back to what Tiffany said, is ask your doctor or ask your pharmacist if these are kinds of things that are going to have some kind of an interaction that's going to cause a problem, potentially cause a problem with your health.
So, we talked briefly about people having a difficult time maybe paying for their medication. And is it okay to, from a doctor or from a pharmacist, or what role should an individual or the clinician play in people being able to get affordable medication? I mean, how, from your perspective, Joyce?
Well, I can tell you that between my two children, my daughter was always able to get her medications. I was always able to I had insurance either with my husband or myself. But my son, when he became an adult, was in between jobs or didn't have insurance, and he ended up doing really badly and ending up in the hospital and ended up on drugs eventually because he could not get his medications. I have been so fortunate that I can get my medications. I did have a helpline call just on Monday at NAMI, and the gentleman said, I called here a few months ago. You recommended RX Outreach. I got in touch with them, and I was able to get a medication that would have cost me $1,000, and he was in between jobs, and it only cost me less than $100, which was still a stretch for him, but he wouldn't have been able to take it otherwise. Yeah. So that's and he was so grateful that we had told him about it. And we do tell people about it at NAMI St. Louis on our helpline.
That's good. Thank you. So, let me ask you, Dr. Bodney, because, a lot of times, and I think it's just human nature, we get a prescription, and sometimes we may look at it and see that it's a brand medication. Do you find patients asking you to can you prescribe something else? Do you ever have that conversation with a patient?
Yeah, there's certainly a lot of interest in having the cheapest possible medicine in that class. And so, there is that price pressure taking place. And so I do have that conversation. Patients will come to me and ask me, I found out that this medicine is going to cost me $500 a month. I can't afford that because I have these other medicines that I also have to take. In that case, I'll try and work with them. And I think most physicians will try and work with them. But I can't work with them if they don't bring that concern to me. Yep. And so that's something that actually does fall on the patient to bring that concern to me. And I know that can be difficult to talk to me about that. I try and make it open. Do you have any concerns about this? But even then, they may not be willing to share that they've got financial issues with the high cost of medicines these days. And I don't have a good solution to that other than trying to make it as easy as possible for them to talk to me if they've got a concern like that.
But in Tiffany, there are options, right?
Yeah, and a lot of times patients will just take the script home or go to the pharmacy and they see the price and they're like, I can't afford this. I'm not going to take this. They don't even ask their doctors, for an alternative, or even their pharmacist if there's a drug that they could potentially use instead of that one. Even if it is in the same drug class or not, there's always substitutions that they can work with on a drug schedule to help the patient out at a lower cost. Once again, it's up to the patient to ask about that because we don't know what they can afford and what they cannot.
So I want to change my answer, okay? Because when the patient comes back, let's say I'm a lung doctor and they've been having bronchitis and I give them medicines and they come back and they're no better. The question that I want to know is, are you no better despite taking your medicines, or are you no better because you didn't take your medicines? Because I'm going to do two different things depending upon what that answer is. Mm-hmm. So even though I said it does fall, and Tiffany said it does fall on the patient's responsibility, in the follow-up, there is an opportunity for me to figure out whether they're actually taking. Now, if the patient is not willing to share information and be truthful with me that they're not taking their medicine, I'll tell them, look, I don't care what your answer is, but I just want to know what pathway I have to take in order to help get you better. Right. And if you're not taking your medicine, let's figure out a reason why you're not taking the medicine and figure out how we can solve that problem. If you are taking your medicine and you're not getting better, then I got some more work to do trying to figure out why you're not getting better.
Right.
So I did want to change my answer.
No, and that's good too, but I think that there also needs to be mention of the fact that there are other patient assistance programs by the manufacturers that people can go to as well. There are copay assistance programs that are online and available that people can go to as well that might provide some assistance and some relief. So even when it might seem like there might not be any assistance or help, it's always important to ask, because even at our organization, at RX Outreach, if we don't carry the medication, we have no problem in trying to help you and work with you to be able to get you to the right source. And so I think that, even as you all have kind of outlined, it's about the importance and the need to be able to take the medication. But if you're not getting healthy, you have to have that conversation if you're not taking your medication with the right party. You have to be able to come forward and speak to that. The cost of medication is very high these days, as we all know. So let me ask you this question. All right, if I can't afford my medication and maybe I have a family member that's taking something that might seem similar, what should I do? Is it okay for me is one statin as good as another? Or if they are taking this and you have prescribed me a statin, is it okay for me to do that? To take theirs?
Well, in my mind, there's two answers to that question. Okay. One is, if you're taking your loved one's medicine, then they're probably not getting the full dose of their medicine, okay? Yeah. And then now you got two problems because you're not going to be taking enough to solve your problem either, right? Because now you're sharing one prescription between two people. But it may not actually be the right medicine for you as well. And medicines are complicated. And even when the medicines are in the same category or class, they're statins or blood thinners, they do have different profiles and characteristics. And depending upon what your own particular health background is and your physiology, one medicine may not be the right medicine in the same category as another one, the way they're cleared by the body, for example.
Okay.
So it's very important not to do that because that's just a bad idea. What more can I say?
Yeah, and is anything we want to share on that, Tiffany?
Well, definitely, you could have an allergy to a medication that your family member does not. It could lead to even death in that case if you have an anaphylactic reaction. Very, bad things could happen if you did that and you didn't know. Also, it's illegal to share medications, especially, controlled medications. So also.
So I've been taking my medication. I feel pretty good. Is it okay just to stop it? I'm good now. Can I just stop taking it? What's the harm in doing that?
Well, there are side effects. There are tolerances that build up to the some medicines that you take. And if you withdraw from those medicines, you're going to get side effects from the withdrawal process. That is not necessarily the withdrawal that you get, let's say, from opioids and things like that. That could be a marked increase in your heart rate, a dangerous elevation in your blood pressure. It could be a variety of different things that you might not think of as a side effect, but are truly side effects. So in those kinds of situations, if you really think that you're not needing the medicine, I would go back to the doctor and I say, you know what? I don't think I need this medicine anymore. Your doctor may disagree and try and persuade you otherwise, saying the reason why you're doing so well is because you're still on your medicine. But if you want to try a drug-free vacation, so to speak, let's do it in the right way. Let's take you down in the right way. Some medicines you can stop cold turkey. Other ones you need to withdraw by gradually reducing the dose. Steroids are very dangerous to stop just cold turkey. That it can be if you've been on them long enough, that can be a life-threatening event if you just stop cold turkey. Those have to be gradually reduced. Beta blockers and other kinds of medicines the same kind of way. So I would do that under the guidance of the physician. And then also after that, if you still have questions, the pharmacy, like the pharmacist like Tiffany, can provide some good information on what you might expect as well if you forgot to ask the doctor that.
And even with mental medications, they could lead to, a manic episode or a, depressive episode, which could completely, that could lead to loss of work, losing your job because you don't function properly anymore.
Or loss of life.
Yes.
Or
Loss of life.
Yes.
So, in the loss of life aspect of it, the medications are prescribed to treat a chronic condition. And when someone decides not to take them, are they putting their life at risk? I have high blood pressure. I feel okay, and I decide to stop taking my medication. Am I putting my life at risk by taking that type of action?
And that's one of the big problems with the medicines for high blood pressure. High blood pressure is not going let's say a 30-year-old who's got high blood pressure. They're not going to die in 5 days because they didn't take their medicine. They're not going to have problems from a heart attack in 5 years from not taking that medicine. The impact of high blood pressure extends over years and years, decades even. It's when you're 50, 60, and older than that not taking your medicines for 20 years with high blood pressure, that's when you're going to see the effects. And that's one of the problems with taking medicines like high blood pressure is I'm not getting any bad symptoms right now. So I'm good. I'm good. But now, 20 years from now, you're not so good because all that damage has built up over time.
Yeah, your heart and your vessels, it's very hard on that. They call it the silent killer for a reason. No symptoms. Sometimes people get an occasional headache, but usually people don't have any symptoms at all. High blood pressure, so
let me just remind our viewers out there as well that if you have any questions that you would like to pose to our panel, please feel free to send them over to us, and we will be happy to ask those of our panelists as well. And so what do you do if you are a caregiver and the person you are caring for refuses to take their medication?
Okay, so that's a huge problem. It's a very huge problem. And what I tell people who call the helpline and what I've talked with my children about is that the doctor prescribed these for a reason. And I also use examples of myself having had to take medication and how much it's helped me. I also tell them you have to catch them at a time when they're open to this conversation. If they're having symptoms and they're very upset and you're screaming, it's not going to do any good to try to talk to the person about it. But it needs to be said. Now, when I told my son he needed to be on medications, he didn't speak to me for 3 months, because he didn't feel that he needed to be on medications. So it's very tricky, and you can't force people to take medications, even if you are their guardian. We come up across this a lot on the helpline. So it's very difficult.
Okay.
I would also add that I think it's important to figure out why they're refusing to take their medicines. As Joyce says, her son didn't feel like he needed the medicines. But that's not the only reason why somebody may refuse to take them. It may hurt when they're swallowing. Or they feel that every time they swallow it, they are risking it going down the wrong tube. Or there are other reasons why they're refusing to take their medicines. So trying to figure out, is it because they just don't feel they need it? Or is there something else that we can actually address by changing the medicine? Making, instead of a pill, make it a liquid if that's available. Or looking for alternative routes. There's medicines that we might be able to put by a skin patch rather than orally. So I think it's also important to figure out why they don't want to take it.
Yeah, there's also injections out there and dispersible tablets, if they have the trouble swallowing, which a lot of older people do. So
the injections have really seemed to change a lot of the problems, especially with people with schizophrenia, because if they forget or if they think, they don't need to take it, or they get confused about whether they've taken it, the injections really help them to kind of bring them down to a level where they are more lucid about taking medications and where they can focus on it better than they could when they were having psychosis or anything like that. So the injectables have really made a big difference in the mental health arena.
There's a lot of conversation going on about pain medications for different reasons, but if we just think about pain medications, is there the potential to build up a tolerance whereby the medication is no longer as effective as it was when I initially started taking it? I mean, can it be like, I won't say an immunity, but can I build up a tolerance if I'm taking an opioid, for example, and it not necessarily give me the same effectiveness that it did in the very beginning?
That's clearly the case.
Yeah, that's why they continue to increase doses for patients, and not always should be, but they do. That's why the lowest dose that's working for you is the best to stay at for all medications, really, and lessens chances for side effects and everything like that too.
There are some people that, just to stay in the pain medication space for just a moment, that with chronic pain that they live with every day. And, there are different guidelines that have come out and been promoted. How do you treat a patient that, has that chronic pain scenario in addition to the guidelines that we see taking place today, Doctor?
There are bona fide ways of trying to treat chronic pain that work without using the opioids. So that's one thing. Two, there are ways that we can reduce the dependence on opioids when they're being used. Now, there are a little bit. It's so nice to take a pill and then have your pain go away, or you take a pill and your headache goes away, right? You take 2 aspirin or 2 ibuprofens, and it's really nice to do that. Mm-hmm. But there are other ways of getting rid of chronic pain. There's a big body of literature on various psychotherapy approaches to managing chronic pain, on alternative approaches to that for musculoskeletal pain, using yoga and other relaxation kind of techniques. Mm-hmm. Not everything is best addressed through the pharmacy, with my apologies to the pharmacists. But it is so nice that for me, here, take this pill. For the patient, I'm going to take this pill. But it's not necessarily easy, is not necessarily the best way to do things.
So, I'm taking my medication, right? Mm-hmm. And I feel pretty good. And is it okay that since I feel good, to say, take more? If that dosage worked for me, will more work for me even better? Should someone do that?
That gets back down to the science that I was talking about before. So what we've noticed in lots of studies is that there's usually a window of opportunity here. If the blood level of that medicine is too low, it's not going to be effective. If the blood level rises above out of that window, then you're going to start having an increase in side effects. Mm-hmm. So more is not necessarily better. More could actually be harmful. Mm-hmm. And so I think it's important not to experiment in that way. I know people like to do that. Mm-hmm. Okay? It's a natural tendency. Mm-hmm. Well, is more better. But I think by understanding that these are chemicals, these are going to have an effect that's beneficial within a certain range, not have any impact below that range, and have adverse effects above that range is important to understand, because that's true with anything.
Yeah, it's always important to take it as they've been prescribed, and if they are confused about the way that it has been prescribed, they can ask. Sometimes patients will take 2 tablets because they thought that's what the doctor said in the office, but they don't actually look on their prescription, or vice versa, so make sure they're taking it the proper way is very important for them too, whether it be through the pharmacy or the doctor. It's definitely important.
I think this is I think I see my daughter does this a little bit. And so, for example, I have the flu or some other acute ailment, and I'm prescribed a medication, and I don't take it all because I get better, right? But, sometime down the road, and I have a similar experience, and maybe the medication is expired. Is it okay to go back and take that medication because I knew I had to treat this same condition that I know that I have?
Well, one for antibiotics is never a good thing to do because that just leads to antibiotic resistance. It's becoming very common, and it's something they're really cracking down on. A lot of doctors won't even prescribe antibiotics anymore until after maybe 2 weeks of symptoms, and they're not getting better because of that reason. Mm-hmm. Most prescriptions on the bottle that you get are usually a year from the day that it was written. We know that a lot of medications are good longer than that, than the manufacturer date, but it is still not wise to take medications that, you don't know how long they've been there. Sometimes people take them out of their pill bottles, which is never a good idea also. Mm-hmm. They mix their tablets it could also affect the composition of the tablets and other tablets, and so that's something you don't ever really want to do. But
Okay, well,
The other side of that question is, let's say you had a cut and got infected, so the doctor prescribes antibiotics for you. And it looks good on the surface that it's healed up, but there could still be residual bacteria that you can't see. And as soon as you stop the antibiotic too soon, and then that just gives that, you haven't completely eradicated the bacteria, and then they come right back again. A week later, you got just as bad an infection. And as Tiffany says, now maybe it's resistant to that antibiotic that was so effective to begin with.
so you have a prescription. This is what I'm hearing. You have a prescription. The doctor gave it to you. You should take it and take the full dose or the full regimen of the medication that's been prescribed to you. And that would be the best course of action. Let me ask we hear a lot about, mental health. And for example, with RX Outreach, we have a program that helps ex-offenders or returning citizens by giving them medications free when they're coming back home. And Joyce, can you maybe speak to this? How does having a bipolar disorder impact your everyday life?
Okay. Well, I have a lot of depression and anxiety. And if, say, I don't sleep well the night before, I take trazodone for sleep, but sometimes I just had a knee injury and I didn't get any sleep because every time I moved, I had pain. The next day, I could not work. I just physically could not work, and my blood pressure had been driven up by the pain. And so I find out that if I don't take my medications, or even if I take it late, even with those things, I still could have a really bad day. And I could be depressed, and I could be anxious. And it makes it difficult to not let other people see it, to not let them know that I'm struggling because of stigma. And there are lots of things going on that I have trouble with. If I'm having a bad day, if I haven't slept, if I haven't eaten right, and I do mindfulness and things like that too, because those do help, and medication isn't the end all to the situation, but I still struggle.
So Dr. Bodney, do you see with your patients, do you see a higher incidence maybe of anxiety or mental health in patients that are coming to see you these days? Is that, or is it about the same, or do people, or just maybe people more open to having that type of conversation?
I'm going to have to punt a little bit on that because I have a fairly specialized practice with pulmonary patients. True. But anxiety is a big part of having lung diseases because they don't breathe well. And so in that context, I do see a lot of anxiety. And there is some, I would say, more awareness of the anxiety that comes along with that, particularly as the disease progresses and they find that they're not able to walk as far without getting short of breath and so on and so on. So I would say in the context, in the clinical realm that I have visibility to, is even there with a very limited kind of a population, I'm still seeing a little bit more anxiety about things than I used to.
Tiffany, from a pharmacist interaction with patient perspective, are you seeing any trends or anything differently? Do you have more conversations about medications around mental health?
Well, I know I see a lot of prescriptions for mental meds come through. It's very common. We have a lot of prescriptions out there, a lot of medications on our program that are for that. It is a bulk of what we do every day. As far as patients calling, sometimes they will call with anxious problems. They have an anxiety problem and they want to, anxious because they're not sure that they're going to get their medicine or that they can afford it. So you'll even see that. So they're anxious already, and then they get even more anxious. So I do see things like that, but.
And actually, that's probably where I see more anxiety, actually, now that Tiffany mentions that, is over the cost of the medicines. Because the medicines that we prescribe actually do work. And then, the generic brand is discontinued for some reason, and out comes a brand new brand name.
Yeah.
And then the price is now 5 times, 10 times what it was before. And then, the cost causes a lot of anxiety because they know that they're going to have difficulties affording the medicine that they feel is working for them.
And I do believe that we have to excuse you because you're going to be leaving us a little bit early today.
Yes, I am.
But first of all, before you go, I want to thank you. I want to thank you for being a part of this opportunity to speak to our audience and share with them your wisdom and knowledge as it relates to the importance of adherence to medication. And so we really appreciate it and thank you, and we'll have you back.
Well, thank you very much. Actually, I greatly enjoyed participating. It was wonderful meeting both of you and hearing your stories. And so, yes, be happy to participate again.
Looking forward to it.
All right.
So let's segue. I'm going to ask 1 or 2 more questions, and then we'll probably begin to wrap this up. So Tiffany, I think we talked a little bit about options, but what if someone has some challenges or difficulty with swallowing their medication? What should they do?
Well, ask your doctor first if there is something like a dissolvable tablet or, a sublingual tablet, injection, patches, or even your pharmacist, can I crush it? What can I do to ensure that I get it and, it works in my body properly? I would say that,
So just look for alternative means, talk to your doctor, or come to the pharmacist and see what might be some other good options.
Yeah, for sure, because there are lots of options out there for patients, that can't swallow and things like that.
Yeah.
So.
And just I want to close with this particular question. We talked a little bit about mental health, psychiatric medications, and, is there, how quickly should someone expect to see some improvement, or even in your own reality, right, with your children? And when they're taking the medication and seeing that they're getting better, is there a reasonable expectation that someone should have?
Well, actually, a lot of, again, dependent upon the medication, but, some such as like your benzodiazepines are going to be immediate. Other like antidepressant
What type of medication? Give me an example.
Like lorazepam,
okay.
diazepam, clonazepam, things like that are going to be, immediate. Things like your antidepressive meds can take, anywhere from like 2 to 8 weeks. You may start to feel some, better at about 4 weeks, but maybe not feel your full, yourself until like 8 weeks. But So don't give up on the medication just yet. Give it time to work before you just want to stop taking it and say it doesn't work, because a lot of patients want to do that, especially with those kind of medications.
We get a lot of helpline calls about that people are saying, I don't want to take this medication, I'm going off of it, and I'll tell them, give it a little time before you go off of them. Don't just keep jumping from medicine to medicine. And I'm sure their doctor's telling them the same thing, so sometimes it's just a reinforcing with them. But I can tell you that before I went on a mood stabilizer, I was already on antidepressants. I cried all the time. I could not control it, and sometimes for absolutely no reason. And when I went on the mood stabilizer, I was driving down the highway and I noticed that the sky was blue and the trees were green. And I could feel that I was better. And so if you can get to that point, you can just hang on, and I tell people that, then you will see the good effects of the medication.
That's very good. You know, and so let's just do this, if I might. Let me just wrap up with this question, because a lot of times we all have medications that we don't completely take. What should I do? How should I dispose of, the medications that I'm no longer going to be taking?
Definitely do not flush them down the toilet or down the sink, anything like that. The best way is to put it in a plastic resealable bag, mix it with some kitty litter or some coffee grounds, so undesirable substance, and seal it up and throw it in the trash receptacle away from, any children and things like that. That's pretty much the best way of disposing, unless you have a drug take-back program at your local pharmacy, or, even your doctor's office may have them once in a while. That's the first thing you should look for, but I know they're not always available, or people don't want to, take them there.
But there should be some prescribed way, not the refuse, not the trash, not the in the bathroom, but some way of being able to make the medication inert.
Yes.
By what you're talking about. So I think that at this point, I want to thank both of you for participating and being a part of this. And I also want to thank those guests out there that have joined us for the very first of what we hope to be a series of webinars on the topic of medication, adherence, and pricing. And so there's much to be said in those areas, and we will bring forward people that can speak to those topics and give you some sound advice about what you should do in particular situations on those topics that I just mentioned. So hopefully we've answered all of your questions, but if we didn't get to something and answer it here, we will make sure that we follow up with you and send you an email. And don't forget, coming up on May 4th, join us for the NAMI Walk St. Louis at Chesterfield Central Park. Thank you very much.